Steve, can you talk more about what you do in educating patients?
Absolutely. Well, let me start by saying that what I don't have yet, which I promised David DiMuzio that I was going to get, is a crystal ball. I don't know, maybe most of you out there are too young to remember the Wizard of Oz, the original Wizard of Oz, but the Wicked Witch had this big green ball with all kinds of smoke around it where she could see where Dorothy and the clan were going. And I wanted to have this crystal ball set up, and that's really figuratively what I do. It's not about selling a hair transplant, as you know, Lance. It's about what are you looking to do now, in 10 years from now, in 20 years from now, and what is it where you're going to be in the future. And that, I think, is really important. And I guess the only way that I had learned that was from the School of Hard Knocks. I mean, I've been through it all, and that's not really important to talk about right now, but my education from being through it all was when I see a young guy like Lance, I want to map out at least the next 20 years. There's a lot of things to consider when you're looking at different types of procedures. I want to make something clear right now, okay? I have no prejudice or I have no favoritism toward any particular doctor or clinic or group or corporation or type of procedure or machine company or robot machine. It has nothing to do with that. It's what's going to be best for the patient. The patient is, excuse me, the patient is what's most important to me, always has been and always will be. So Lance, now that I've got him cornered in front of a camera here, he's one of my favorite patients, of course, as is David DiMuzio, and who many of you probably have seen on YouTube videos. And there's many other patients. I always answer my phone, whether it's after hours, on weekends. This is kind of an emotional thing, and people want answers to their questions. So the point is that what procedure would be best for you? What type of preventative treatment would be best for you? What are you looking to achieve? Where do you live? What's the geography? I mean, I talk to people around the world. And what is your hair in the back of the head, which is what we refer to as the donor hair? What type of hair do you have? What type of hair loss do you have? What type of genetics, meaning family history, do you have? These are all the things that, I guess, if the crystal ball had some sort of a way to insert this data, which is probably called a computer, we could spit out something that would give us a reflection of really what the best procedure would be for you. Should you be taking a medication, or should you be using a laser cap? Should you be rubbing minoxidil on your head? What's A-cell PRP? What's the difference between a follicular unit transplant and a follicular unit extraction? Why are there NeoGraft machines and robotic algorithm type machines? And these are questions that people find difficult to get the right answers for, because the majority of the online information is really centered around advertising and marketing. So I think that, in answering your question specifically, Lance, it really comes down to making sure that we collect all our data, that we know your situation, we don't buy into the hype, we don't get excited and jump into the first thing we see in regards to online marketing. You want to look at the science behind the procedures first. It's 50% science, 50% art. The art is all about the website in today's world, sorry to say. Videos, photos, it's all about the website. And then I'm sure we'll talk in the future about the different philosophies of doctors, the different types of procedures, when to use them, when not to use them, what type of clinics to look for. But anyway, all these things are how I help pretty much briefly in today's world, and within a 20-minute phone call, kind of set the patient up for success.